I apologize for the serious nature of this topic. I wanted to apologize in advance. This is a heavy topic. After working as a mental health therapist for 16 and a half years, along with a few more years of working in psychiatric hospitals, things of that nature, this topic is one of the most difficult to discuss, but it's at the core of a lot of mental health disorders and a lot of emotional issues, and that topic is trauma. As everybody knows, there's a lot of different ways that somebody can be traumatized in their life. I'm not going to list all the ways that somebody can be traumatized, but I'm going to talk about a few of maybe the more significant types of trauma and its impact on people's mental health. So we start out in this life with caregivers, right? So childhood trauma is usually the first type of trauma that comes to mind for a lot of people when they think about this topic. When it comes to childhood trauma, there's a few different types of traumatic things that can take place that is more frequent than not. I'm not going to go into a ton of detail in specifics about some of these traumas, just because it can get pretty low, and I don't want to go down that road. And generally speaking, that to me is more of a personal thing that is needing to be talked about during therapeutic sessions. So obviously there's sexual abuse, physical abuse, and psychological abuse. All of these intertwined with emotional abuse as well. I get a lot of questions and confusions from people about what's considered psychological abuse. If you think about it, it's not that in depth, but anytime that you grow up in an environment where you're criticized a lot, where you're belittled, isolated, where you're made fun of more frequently than not, especially in a way that you don't like. I mean, I'm the type of personality, I like to have fun, I like to tease my children, things like that, but if it gets to a point where it becomes serious and then you're really making fun of somebody, that's obviously along the lines of psychological abuse. Now, obviously with these types of traumas, it's important that a person realize how that's affected their life. These can be done in therapeutic sessions, but also you can do some self-analyzing and identify, okay, how was I affected by this trauma? How's it impacted the way that I think, the way that I feel, the way that I act? All of those kinds of things. So this is where I feel like psychotherapy is very valuable, and that is that, if I talk to certain clients of mine, each client could respond to a trauma in a completely different way than another person. So it's very individualized. You can't just say, look, like, this trauma happened, A trauma happened, so B, this is what's going to happen with the person's thoughts, emotions, behaviors across the board. It just doesn't happen that way, and that's why humans are unique, and I don't want to beat a dead horse with that kind of stuff, but at the same time, it's important for people to understand how trauma can individually affect you. Obviously, there's different levels of trauma as well, right? Some people are traumatized more than other people, and sometimes even within that individual, they can be traumatized more at different stages of their life compared to other stages of their life. So real quick, I would like you to comment below about how you've coped with the traumas in your life. I think that would be helpful for a lot of other people that might read the comments. I just wanted to throw that in there before I forget. So I'm going to be a little bit vulnerable with a whole bunch of strangers on TikTok right now and kind of tell you just one example of maybe a trauma that I experienced growing up, and that is I grew up in a very good home, loving parents, loved my parents, good family, but I grew up very small. I was a small kid, tiny kid. I was really into sports. But as a small kid, I was teased and I think probably borderline bullied with some people because of how small I was. And because of my size, A lot of kids were just kind of relentless about it. So that really negatively impacted my sense of worth, at least growing up. But this is how it works. So this is just an example. So what I ended up doing, without even realizing it, is I started to get tired of being small. So naturally, I started doing push-ups, sit-ups, pull-ups in my bedroom every night, from I think 7th grade on until I could get into a weight room, and then I've been lifting weights ever since then. So it wasn't until I was probably closer to young adulthood when I started to realize, yeah, that's probably why I started lifting weights a lot, is because I got really tired of being, called small, and it really impacted my self-worth that way. Now I view it as just a healthy thing. I don't have any lingering issues when it comes to being small. In fact, now that I'm older, it's kind of the opposite. Especially after the holidays, I kind of want to just, go back to my small ways, if you know what I'm saying. Anyways, I don't want to make this video too long. Just understand how trauma has impacted your life. Don't be afraid to share your story with other people who are willing to hear it. Obviously, you don't want to just spread your trauma to everybody and their dog. Just make sure that you have trustworthy people that are willing to listen, willing to pay attention to you, willing to be supportive in that sense. And I almost guarantee you they'd be willing to tell you their traumas as well. But to end on a positive note, not all of your trauma has to linger throughout your entire life. I just want you to understand that there's a way for you to be able to heal from it. Obviously, there's something very, very, very wrong with our world, to the point where we all experience these levels of trauma. I don't understand why our world and our reality is in such a way to where trauma just happens all the time with so many different people. It really kind of boggles my mind to understand, or to try to understand, why our reality is this way. But that's neither here nor there. The point is that I want you to understand that you can heal from it. There is a way for you to be able to get past it. Talking with people helps, obviously, that kind of stuff. But your self-care is very important in you being able to overcome your traumas and to be able to cope with them. But at the same time, you don't want to repress, just like I talked in my video yesterday. You don't want to repress them, and you want to seek help where you can from mental health professionals, obviously.